In Silicon Valley, dreams are spun from drops of blood, where one company promised miracles but delivered deception. This is the story of Theranos, where billions were fooled by a single drop. Founded in 1923 by Elizabeth Holmes, Theranos claimed its miniature blood tests could diagnose diseases using just a pinprick's worth of blood, revolutionizing healthcare. With the allure of rapid results and lower costs, investors poured billions into Theranos, believing it was the future of medical diagnostics. But beneath the surface, a web of lies was spun. Holmes captivated venture capitalists like Tim Draper and George Shultz with her vision. They saw a chance to disrupt an industry and backed her with unwavering faith. But behind closed doors, Theranos struggled with unreliable technology. Their machines often produced inaccurate results, leading to a dangerous charade. Despite the setbacks, Holmes maintained a facade of success, showcasing prototypes that looked impressive but had never been proven effective in real-world settings. Employees who questioned the company's practices faced retaliation and intimidation. The culture of fear stifled any dissent, allowing the deception to continue unchecked. It wasn't until investigative journalists began digging into the company's claims that the truth started to unravel, exposing the massive fraud behind Theranos' facade. This documentary explores how one woman's dream of revolutionizing healthcare turned into a multi-billion-dollar deception, leaving a trail of broken trust and lost opportunities. Elizabeth Holmes envisioned a future where a single drop of blood could diagnose multiple diseases instantly. Her vision captivated investors and healthcare professionals alike, promising a revolution in diagnostic technology. Theranos claimed their Edison device could perform hundreds of tests with just a finger prick, eliminating the need for invasive blood draws. The allure was undeniable, attracting millions in investment and partnerships. The company secured deals with major institutions like Walgreens and Safeway, setting up testing centers across the United States. Patients flocked to these centers, trusting in the accuracy of Theranos' technology. However, behind the scenes, Theranos struggled with unreliable test results and malfunctioning equipment. Employees raised concerns internally, but their warnings went unheeded by management. Holmes maintained an aura of infallibility, often dressing in all-black outfits reminiscent of Steve Jobs. This image helped her secure billions in funding and endorsements from influential figures. Despite mounting evidence of inaccuracies, Theranos continued to market its technology as groundbreaking. Independent laboratories were unable to replicate their results, raising serious doubts. Investigative journalist John Carreyrou began investigating Theranos after receiving tips about its practices. His reporting revealed the company's exaggerated claims and hidden problems. Carreyrou's articles in the Wall Street Journal sparked a chain reaction, leading to regulatory investigations and the eventual unraveling of Theranos' empire. Investors lost billions, and patients faced potential misdiagnosis. In 2018, the U.S. Securities and Exchange Commission filed charges against Holmes and her co-founder Sunny Balwani, alleging fraud and misleading investors about the true state of the company. The scandal sent shockwaves through the biotech industry, prompting stricter scrutiny of startups claiming revolutionary breakthroughs. It highlighted the risks of unchecked ambition and the importance of rigorous scientific validation. Holmes and Balwani faced criminal charges, marking one of the most significant cases of corporate fraud in recent history. Their trial became a cautionary tale about the dangers of deception in healthcare innovation. While Theranos' dream of rapid diagnostics was compelling, the reality proved far more complex. The company's downfall underscores the critical need for transparency and honesty in medical technology. The Theranos story is a stark reminder that in the pursuit of groundbreaking technology, ethical standards must not be compromised. The consequences of such deception can be severe and long-lasting. Investors and consumers alike were duped by the promise of instant and accurate blood testing. Theranos' collapse revealed the risks inherent in trusting unverified technological claims. The failure of Theranos also highlighted the need for robust oversight in the healthcare sector. Companies must undergo rigorous testing and validation before marketing their products to the public. Patients who relied on Theranos for health information faced uncertainty and potential harm due to inaccurate results. The impact on individual lives cannot be overstated, serving as a warning to all. Despite the setbacks, the pursuit of innovative diagnostic tools continues. However, the lessons from Theranos have led to a more cautious approach, emphasizing the importance of reliability and accuracy. Holmes' vision of a future where a single drop of blood could diagnose multiple conditions remains aspirational. While the technology is advancing, the need for stringent verification remains paramount. The Theranos scandal has reshaped the way new medical technologies are evaluated. Today, companies must provide transparent evidence of their claims to gain trust and credibility in the healthcare community. As the biotech industry evolves, the legacy of Theranos serves as a powerful reminder of the balance between innovation and integrity. The future of healthcare diagnostics depends on both. While the dream of rapid and accurate blood testing persists, the Theranos case shows the importance of skepticism and thorough investigation when evaluating new medical technologies. The Theranos story is a testament to the power of investigative journalism in uncovering truth. Despite facing resistance, journalists played a crucial role in exposing the company's fraudulent activities. In the aftermath of Theranos' collapse, the biotech industry has seen increased calls for reform. New regulations aim to prevent similar deceptions, ensuring patient safety and investor confidence. Though Elizabeth Holmes and Theranos once promised a healthcare revolution, their downfall illustrates the peril of prioritizing profit over science. The lessons learned are invaluable for future medical advancements. Despite the fraud charges against Holmes and Balwani, the allure of rapid blood testing remains strong. Investors and entrepreneurs continue to pursue innovative diagnostic technologies, hoping to avoid past pitfalls and deliver on the promise of quick, accurate results. Regulatory bodies worldwide have tightened their oversight of medical diagnostics. Stricter protocols for clinical trials and stringent validation processes ensure that future breakthroughs in blood testing are rigorously tested before reaching the market. Patient advocates and healthcare professionals emphasize the importance of transparency and accuracy in medical diagnostics. They stress the need for patients to understand the limitations and risks associated with new technologies. The Theranos scandal serves as a stark reminder of the potential dangers when scientific claims outpace rigorous evidence. It underscores the necessity of thorough scrutiny and validation in developing new medical technologies. The Theranos saga reveals the perils of unchecked ambition and the consequences for public trust. Every innovation must balance speed with rigorous testing. Investors, patients, and regulators all felt the shockwaves of Theranos' collapse, a stark lesson in the importance of transparency. In the wake of this scandal, healthcare institutions must prioritize ethical practices and robust validation of new technologies. This cautionary tale calls for stricter oversight and collaboration between innovators and regulatory bodies to safeguard patient care. As technology advances, vigilance is key to prevent similar deceptions from undermining the future of healthcare. The Theranos debacle has spurred significant reforms in medical diagnostics and data privacy, aiming to rebuild lost trust. It serves as a powerful reminder that in the pursuit of innovation, integrity must remain the cornerstone of progress. Let us learn from this chapter in history and strive for a future where healthcare innovation thrives under the watchful eye of accountability. We must ensure that every drop of blood analyzed contributes to genuine advancements in health and wellness for all. Through collective vigilance and ethical commitment, we can prevent future Theranos-like incidents and protect patient safety. Together, let us foster an environment where innovation flourishes while safeguarding the well-being and trust of every individual.